Welcome back to our AHIMA CHDA exam preparation course, where we are now stepping into the essential world of data quality, integrity, and governance. In this lesson, you will learn exactly how to identify, measure, and improve the accuracy and reliability of healthcare information. Understanding these rules is incredibly important, because making medical decisions based on flawed data can lead to terrible patient outcomes and massive financial losses. Get ready to discover the strict standards and privacy regulations that every single hospital must follow to keep patient records safe and accurate. Let us dive right in and learn how to protect the integrity of healthcare data. And to help lock in these foundational rules as we go, I highly recommend downloading our offline app or grabbing the practice tests, which serve as excellent educational resources throughout your study journey. When we talk about data in healthcare, we must clearly distinguish between data quality and data integrity. Data quality simply means that the information is accurate and completely fit for its intended use, such as treating a patient safely. Data integrity is a slightly different concept that focuses on keeping the data safe from unauthorized changes, accidental deletion, or corruption over its entire lifespan. For the exam, remember that you need strong data integrity policies to ensure that your data quality remains consistently high over time. To help hospitals maintain this high standard, AHIMA created a famous framework called the Data Quality Management Model. This specific model breaks data management down into 4 distinct areas, which are application, collection, warehousing, and analysis. Application looks at the purpose of the data. Collection focuses on how the data is gathered. Warehousing deals with storage. And analysis covers how the data is ultimately used. Understanding these 4 interconnected domains will help you pinpoint exactly where a data error occurred in the hospital system. A major part of the CHDA exam involves knowing the specific characteristics of good data. Starting with accuracy. Accuracy simply means that the data perfectly reflects the true clinical reality of the patient. For example, if a patient weighs exactly 150 pounds, but the nurse accidentally types 105 pounds into the computer, that data is no longer accurate. Inaccurate data is incredibly dangerous in healthcare, because a doctor might prescribe the wrong dosage of a powerful medication based on that typo. The next important characteristic is accessibility, which means the right people can get the data exactly when they need it. A perfectly accurate medical record is completely useless if the emergency room doctor cannot open the file while treating a critical patient. However, accessibility must always be balanced carefully with security, meaning that only authorized healthcare workers should be allowed to view the information. This delicate balance between easy access and strict security is a daily challenge for healthcare data analysts. Another heavily tested concept is comprehensiveness, which dictates that a medical record must contain all the required information. Think of comprehensiveness as ensuring no pieces of the puzzle are missing from the patient's chart. If a hospital policy states that every surgical patient must have a signed consent form on file, a record missing that form fails the test of comprehensiveness. Analysts regularly run special reports specifically designed to find these incomplete records so the doctors can fill in the missing details. Working through these scenario-based questions in our practice tests or testing your knowledge on the go with the offline app can quickly highlight how these attributes are framed on the actual test. We also need to ensure data consistency, meaning that a patient's information means the exact same thing across every single computer system in the hospital. If the pharmacy system shows a patient is allergic to penicillin, but the main electronic health record says they have no allergies, you have a massive consistency failure. Resolving these dangerous inconsistencies requires the analyst to investigate both systems and figure out which piece of data is the absolute truth. Consistent data guarantees that every department is working with the same reliable information. Two highly related characteristics you must know are currency and timeliness. Currency simply means that the data is up to date, such as having a patient's most recent home address on file. Timeliness refers to how quickly the data was actually entered into the computer after an event occurred. If a doctor waits 3 weeks to type up the notes from a patient visit, that data is no longer timely, which negatively impacts billing and ongoing clinical care. To prevent confusion, every piece of data must have a clear data definition, which is another core quality characteristic. Data definition means that users clearly understand what specific information belongs in a given field, which is why we rely so heavily on the data dictionaries we discussed earlier. If a hospital tracks whether a patient has a fever, the data definition must explicitly state exactly what temperature officially counts as a fever. Clear definitions prevent different nurses from interpreting the same exact computer screen in completely different ways. The final two quality characteristics you will encounter are granularity and precision. Granularity refers to the level of detail collected, such as recording a patient's heart rate down to the exact minute rather than just a daily average. Precision refers to the exactness of the measurement itself, such as recording a temperature as 98.6 degrees instead of rounding up to 99. Depending on the type of medical research being conducted, an analyst must carefully decide exactly how granular and precise the extracted data needs to be. Now that we understand quality, we must look at how hospitals enforce these rules through a formal structure called data governance. Data governance is a massive set of organizational policies, procedures, and rules that dictate exactly how data is managed as a valuable business asset. Without a strong governance program, different departments will simply create their own random rules, leading to chaotic and completely unmanageable data. The exam views data governance as the absolute foundation of a trustworthy and reliable healthcare organization. You must also understand the clear distinction between data governance and information governance. While data governance focuses on managing the raw numbers and technical formats, information governance takes a much broader view. Information governance focuses on how the entire hospital uses the data to make strategic business decisions, improve patient care, and comply with federal laws. Think of data governance as managing the building blocks, while information governance manages the final house you build with them. To make all these rules work, hospitals establish a formal data governance committee made up of key leadership figures. This committee usually includes the chief information officer, top doctors, legal experts, and senior data analysts like yourself. By bringing all these different perspectives together, the committee can create fair data policies that work for the entire hospital, rather than just one specific department. This group has the ultimate authority to settle arguments about how data should be standardized and shared. The people responsible for actually enforcing these governance rules on a daily basis are known as data stewards. A data steward is usually a manager or a highly experienced employee within a specific department, like the director of the pharmacy or the head of the laboratory. They do not necessarily fix the computer servers, but they are absolutely responsible for ensuring that the data entered by their team meets all the quality standards. Data stewards act as the crucial bridge between the high-level governance committee and the everyday hospital workers. One of the most important tools used in data governance is called Master Data Management, or MDM. MDM is the technological process of creating one single, highly accurate source of truth for the most critical pieces of information. The best example of this is the Enterprise Master Patient Index, which is a specialized database that ensures every patient has exactly one unique record across the entire hospital network. By using master data management, hospitals prevent the dangerous creation of duplicate patient charts. Protecting this high-quality data requires strict adherence to federal privacy laws, most notably the HIPAA privacy rule. HIPAA dictates exactly how protected health information, commonly called PHI, can be legally used and shared. The rule generally allows hospitals to share PHI without patient authorization for three specific reasons, which are treatment, payment, and healthcare operations. As an analyst, your work usually falls under healthcare operations, meaning you can analyze the data to improve hospital efficiency, provided you follow the minimum necessary standard. The minimum necessary standard is a fundamental HIPAA concept that will definitely appear on your exam. This rule states that you should only access the absolute minimum amount of patient information required to complete your specific job task. If you are asked to calculate the average length of stay for pneumonia patients, you do not need to look at their psychiatric records or their financial billing details. Understanding and applying the minimum necessary standard is a daily ethical requirement for every single healthcare data professional. While the privacy rule dictates what you are allowed to do, the HIPAA security rule dictates exactly how you must physically and technically protect the data. The security rule requires administrative safeguards like employee training, physical safeguards like locked server room doors, and technical safeguards like complex passwords and data encryption. Encryption is incredibly important because it scrambles the data into unreadable text, ensuring that if a hospital laptop is stolen, the patient information remains completely secure. To ensure all these privacy and quality rules are actually being followed, hospitals regularly conduct formal data quality audits. An audit is an active investigation where analysts pull a random sample of medical records and manually check them for missing data, coding errors, or unauthorized access in modern systems. This is supported by automated audit trails, which are hidden computer logs that record exactly who opened a patient's chart and what they looked at. Regular auditing is the absolute best way to catch mistakes early and prove to federal regulators that the hospital takes data integrity seriously. Data governance sets the organizational policies, while data quality management tools like the AHIMA model execute those rules at the operational level. Both are critical for maintaining valid, audit-ready clinical information. Congratulations on completing this highly important section on data quality. integrity, and governance. To truly master these definitions and HIPAA regulations, I strongly encourage you to complete the attached practice tests right away, or utilize our offline app to continue reviewing whenever you have a few free minutes. Testing yourself with realistic practice questions improves your memory retention and is essential for gauging your exam readiness. These essential practice tests and the offline app are excellent ways to support your learning process right here alongside this lesson. Keep up the great work. Embrace the active learning process. And I will see you in the next section where we explore healthcare data analysis techniques.